Welcome to the latest episode of International Law Chats, or ILC, a podcast from the American branch of the International Law Association. The podcast airs on the first Monday of every month, and we hope you will be able to join us each month. I'm Chiara Giorgetti. I'm a professor of international law at Richmond Law School and a senior fellow at the International Claims and Reparation Project at Columbia Law School.
And I'm Alison MacDonald, a barrister at Essex Court Chambers in London and fellow at All Souls College in Oxford.
And my name is Milena Sterio. I'm an international law professor at Cleveland State University's College of Law and also managing director at the Public International Law and Policy Group.
Welcome. We are delighted to be talking to Gian Luca Burci today. Gian Luca, if I may, is probably the leading expert in international health law, a once-upon-a-time niche part of international law, but one that has now become an essential part of it. Gian Luca is Senior Visiting Professor of International Law at the Graduate Institute of International and Development Studies in Geneva and the Director of the Joint LLM on Global Health Law and Governance between the Graduate Institute and Georgetown Law School, as well as an academic advisor in the Global Health Center of the Graduate Institute. He's also visiting professor and senior scholar at the O'Neill Center on National and Global Health Law at Georgetown University School of Law. Before his appointment at the Graduate Institute, Gian Luca served in the legal office of the World Health Organization from 1998 to 2016 and was its legal counsel for over 11 years, from 2005 to 2016. During his service in the WHO, he was involved in the negotiation and implementation of the Framework Convention on Tobacco Control, the revision and implementation of the International Health Regulation, WHO's response to the 2009-2010 H1N1 influenza pandemic, and the 2014-2016 Ebola outbreak, as well as the institutional aspect of WHO reform. Prior to joining WHO, he also worked in the Department of International Cooperation of the International Atomic Energy Agency in the Office of the Legal Counsel of the United Nations, where I had the very big pleasure of meeting him. He is now involved in the negotiation of the WHO pandemic agreement. Gian Luca, let me start with a question. It is hard to believe, but it was about 5 years ago, on March 11, 2020, the WHO declared the COVID-19 outbreak to be a pandemic. COVID-19 pandemic has led to a dramatic loss of human life worldwide and constituted an unprecedented challenge to public health. It also led to the largest global economic crisis in more than a century and innumerable ramifications from food to the educational systems. What do you think are the main lessons that we have learned from the pandemic and COVID-19?
Thank you, Chiara. So it's good to be here. And let me say that Chiara and I became friends in the UN legal office, and we remained friends ever since. I follow her career from a distance, and it's great to see her become an excellent academic and professional at the same time. So it's good to thank you for inviting me. So I think we learned many lessons. The point is, what are we going to do with these lessons? Are we really going to follow up and create a safer world? I think some of the lessons that we learned are first, if there was a need, that most of the fairly bad viral diseases come from animals. And so it confirms the need to have a more integrated approach that reconciles environmental drivers, animal health, and human health. That's what we call the One Health approach. The second is the importance of strong health systems in countries. And health systems are not necessarily depending on the level of environment. I'm Italian, just like you, Chiara, and you remember that in March 2020, the Italian health system, at least in the north, collapsed in a matter of weeks. Some sub-Saharan African countries, at least at the beginning, did comparatively better. So in a way, one of the lessons that we need to rethink what needs to be included as part of a resilient health system at a time of emergencies, of a pandemic, of a shock like COVID. Then two more things. The first, I think that one of the reasons behind the fact that we have a pandemic agreement, that we cannot start preparing the measures when we have a pandemic. So during a crisis, we need systemic, clear, accepted, general measures that are well integrated in a health system and in the international system and kick in when an emergency comes. And then finally, which is again easier said than done, we need a better system of international financing. Needs to be more commitment to domestic financing of health systems and other health measures, but there needs to be a better finance, but also a different model of financing. The development assistance system is not what we need, is not fit for purpose to protect us from future pandemics. These, in my view, are some of the lessons that we learned from COVID-19. Again, learning and putting in practice are two different things.
Thank you so much. Thank you so much also for your kind words. It's really my pleasure, and it's really our pleasure to have you today on our podcast. Can I ask you an immediate follow-up? Now, you talked a little bit about the lessons that we have learned, but what are the lessons that we should have learned and we did not? Many scientists warn us about the possibility of another pandemic in our lifetime, and that it probably is going to be another zoonotic spillover. Are we better prepared for the next pandemic?
I wonder. Depends who you ask. I think that many countries have learned some of the lessons, and so I think they have improved, in particular, prevention and preparedness. Because when something like COVID hits in a matter of days, it's very difficult to respond effectively if you're not a very solid system of prevention, but also of preparedness. So things in place that kick in immediately, that are triggered when there is an alarm. So at the national level, I think many countries are better equipped. At the international level, I hope. And the fact that we have just agreed, the WHO has agreed on a draft pandemic agreement, I think it's a sign, it's a step in the right direction. At the same time, what COVID shown is a crisis of equity and solidarity. North versus South, rich versus poor. And that, frankly, is one of the worst messages that we can send, in particular at this time. So that's something that we haven't learned. That also affected the negotiation. Besides the rhetorical flourish about equity and solidarity, but then, the North and South retreated to their own position. So that, to me, is something that I hope will be integrated better in future systems, but I don't think we have learned enough the lessons of COVID. And to be frank, it's easy to say that political leaders should have been super generals, shared the vaccines and so on, but it's not illegitimate for an elected leader to prioritize its own population. So the point is how to avoid that in the future leaders are put before this dilemma. Multilateralism, not as pure generosity, but to get out of a crisis together and more effectively, versus the need to respond to your own national priorities. That, I think, will be the big dilemma for the future, where we'll see whether the lessons have been learned or whether they have been forgotten.
Well, if I can pick up on that, Gian Luca, you mentioned the draft pandemic agreement. And if we look back to December 2021, at the height of the COVID-19 pandemic, WHO member states established the Intergovernmental Negotiating Body, draft and negotiate an agreement under the WHO Constitution to strengthen pandemic prevention, preparedness and response. And as you say, just last week, after more than 3 years of hard work, intensive negotiations, WHO member states agreed on a draft agreement, and I understand it will be considered at the upcoming World Health Assembly in May. Now, the aim of the agreement is said to be to strengthen global collaboration on prevention, preparedness, and response to future pandemic threats. To introduce that to us and our listeners, can you briefly tell us about the main features of the agreement?
So, if you live in Geneva, people like to be critical all the time. So there are already criticism. This is a weak agreement, it's not balanced enough. But I think it's a major achievement. And 3.5 years is not a long time. There are many agreements that take decades to be negotiated. So I think it is an achievement. The pandemic agreement is very ambitious, and it's a very interesting instrument because on the one hand, the scope is very broad, 180 degrees. It goes from what we call upstream prevention, which is really to try to reduce the risk of zoonotic spillover, of diseases spilling over from animals. And that's not easy at all and not cheap at all. So it goes all the way up the prevention scale and all the way down to issues like financing, like allocation of vaccine, like the supply chain, and so on. So it's very ambitious. At the same time, it's, if you want, its topic is very narrow because it's pandemics. It's really supposed to prevent pandemics, and pandemics are a subset of international disease outbreaks, and hopefully a very rare subset. So the challenge is of fairly demanding measures to try to prevent and reduce the risk of a relatively rare event. It's like an insurance policy in a way. So in a way, some of the, again, it's very broad and it has many topics, covers many topics. To me, the most important are, again, this One Health approach, which is to be cognizant of the fact that environment, animal, and humans share the same space. And so if we want to, even using an anthropocentric approach to reduce the risk of another COVID, there has to be a better management of the space where these three elements come together. There are, the other point that was negotiated until the very last moment is a system to share pathogens, because if you want the vaccine, we need to share the virus. At the same time, at the same footing, sharing of benefits that come from the utilization of these pathogens. That obviously is backed up by the international law biodiversity that is influenced quite a lot the negotiation, and has been quite difficult because you can imagine the global north wants to prioritize access, the global south want to prioritize equity and benefits. But there are many other aspects that sometimes are quite innovative. It's the first time that a treaty talks about, for example, protection of workforce. As you remember, health personnel has been the main victim of COVID-19 for a long time. Or about collaboration for research and development of new medicines, or technology transfer, or a better distribution manufacturing capacity, basically to facilitate the spread of pharmaceutical manufacturing capacity to developing countries, to try to avoid an immediate scarcity of vaccines and therapeutics the moment you have a crisis. And so that triggers the situation like we experienced during COVID. It has also provisions on financing, a very important one on a certain regulation of the supply chain to try to regularize and to make more predictable what is available in the global market and try to stabilize the market, try to avoid what we witnessed in 2020 with countries immediately restricting exports, restricting imports. Italy in March, April 2020 could not procure masks because France and Germany refused to sell masks to Italy. To avoid this kind of situation, to reduce the risk of this situation. This, I think, will be very important. And finally, even though it's a bit weaker than I would have thought, something about combating disinformation. And here, obviously, the challenge is to respect freedom of thought, freedom of expression, so fundamental human rights, while at the same time trying to improve communication. I think communication has been one of the main victims of COVID-19, and try to combat the spread of very, very, very dangerous tactics, disinformation. So as you can see, it covers a lot of ground and is quite ambitious.
And it's very interesting that you mentioned disinformation. I mean, I for one, can't think of another treaty or equivalent that that addresses the topic of disinformation in a specific field. I find that extremely interesting. And it sounds like, in your view, it's a major achievement by states to get to this point in, as you say, 3.5 years, which is lightning speed for the negotiation of international agreements.
Yeah.
In terms of next steps, can you tell us, obviously it's being debated next month, can you tell us the next steps in terms of, if it proceeds, entry into force and implementation?
So we are not out of the woods yet, frankly, because one of the compromises to have an agreement concluded now is to give up the possibility of a very detailed provision about pathogen and benefit sharing, which is really the linchpin, the political linchpin of the agreement. So the compromise was to postpone the fight, and I think it would be a fight, over the details to an annex that will have to be negotiated after the agreement is adopted, or we'll see what, in May at the Health Assembly, so the plenary body of WHO. The Assembly will at the same time launch negotiations on this annex. And so the delegates are very confused, and these are in a way the technicalities of the law treaties of how to go about it, because the idea is to have an annex as an integral part of the treaty. So countries cannot pick and choose, cannot stay out of the commitment on benefit sharing, for example, while being parties to the main agreement. So how to make sure that the agreement first can only come into force once the annex is adopted, but also that the two things are put together as a single package. Because many countries, in particular African countries, want to adopt the agreement under the law or treaties in a way, to freeze the text. But it's odd to freeze an incomplete text because it's missing a part. So the alternative would be a kind of political endorsement. So the assembly would basically endorse the text as it is, express a political commitment by states not to reopen it. That's essential. And then negotiating this annex, when the annex is adopted, hopefully, put it back in the agreement and adopt the whole package. As you can imagine, I know there are other permutations that I will not go into for lack of time. As you can imagine, these are quite complicated alternatives, and they bump into some of the technicalities of the law treaties. They had to be sold to foreign ministries or attorney generals back in capitals. So again, we are not totally out of the woods, and I think a big test will be in May at the Health Assembly.
Thank you. If I might jump in with a more general question, moving to a more general view of health topics. They really seem to be at the forefront in so many ways nowadays, from vaccines to antimicrobial resistance, emerging diseases, as well as other communicable and non-communicable diseases, nutrition, environmental, mental health, to name just a few. What do you think are the most important topics in the health agenda? Is there anything in particular that keeps you up at night?
Many things keep you up at night. In terms of the urgency, so we all focusing now on trying to avoid another COVID-19, and so on zoonotic diseases, on infectious diseases, and that remains very high on the agenda. However, if we look at the mortality rates, the statistics on how many people die every year of what, 65 to 70% of global mortality is not due to communicable diseases, it's due to non-communicable diseases, which are the big four horsemen of the apocalypse: diabetes, cancer, cardiovascular diseases, respiratory diseases. These diseases kill a vast proportion of the people that die every year, and they're not diseases of the rich. There is a huge burden of diseases in developing countries. If there is, in my view, an absolute urgency is this, because it's a man-made disaster. It's alcohol, it's tobacco, it's bad diets, it's carbonated drinks, it's sedentary lifestyle, it's pollution, and it's also mental health with the spread of smartphones and social media that get addicted every day. So this is a huge agenda, and this takes WHO and most of the public health community out of the comfort zone, because historically, they're not very well equipped to deal with these issues, where there is a multi-trillion-dollar industry that resists any attempt at regulation, or they want to minimize regulation. So that doesn't necessarily keep me up at night, but it certainly keeps many people in the public health business up at night. What keeps me up at night is the convergence of a number of factors, of a number of risk factors that frankly risk turning health into something almost unmanageable. Certainly there is a risk of a new pandemic, because the environmental deterioration of the world pushes animal and humans together. And we are seeing, in a way, the tip of the iceberg. We have no idea how many viruses or what nature, what species are present in animal populations all over the place. We really have a huge amount of science to cover. The second is climate change that compounds this problem, makes it more unpredictable, and also, as you know, polarizes politically many countries. The third is a growing awareness of new problems. And to me, one of the scary problems is microplastic. We are discovering now that we, you, me, the people listening to us, are full of plastic. The average brain, apparently, especially in the global north, has something like 5 grams of plastic. So, and people don't have a clue of the health effects of this plastic, short-term and long-term. So if something keeps me out at night, is this, the fact that my grandchildren may be born with plastic in their bodies. We are almost moving towards a post-human world, where we don't know what will be the constituent elements of human beings in a few decades. Sorry to sound so catastrophic, but it's a reality, frankly.
Thank you for
Maybe
that.
not the best way to finish this podcast.
I do have one more question. Now, in terms of legal responses to these emergencies, are we better prepared today? And if not, what else might we need to better prepare ourselves? And I'll give you a chance to be a little bit more positive for this last question.
So I think we are better prepared. Not as much as some people would like to, but the fact that we have a pandemic agreement and the fact also that WHO has amended the international health regulation, in my view, has strengthened them. The two things go together, they're complementary. So if they are well implemented, if there is legal, political, financial commitment, we can really see better preparedness and better prevention. So I think there's some reason for optimism. And also, we always focus more easily on the global aspect, but there are regional realities that are very important. The European Union has learned a lot from this crisis, but also the African continent. African, to me, has emerged as one of the leaders from COVID-19, with a very strengthened African Union, a very strong, very active, very influential African Center for Disease Control. And so, to me, you see parts of the world that are really asserting themselves politically from a public health perspective. And that to me is good news, because not everything can be dealt at a global level. You need strong national, but also regional frames, organizations, measures in place, and so on. So the proof is in the pudding. We'll see whether countries will walk the talk and whether there will be a good faith effort to really put in practice stronger measures. But I think and I'm happy to finish on a more optimistic note. I think that there's some reason for optimism. Of course, one of the biggest variable is what the United States will do. Right now, it doesn't look very promising. With the Secretary of Health that doesn't believe in vaccine, with the Trump administration having stopped overnight the exchange of communications with WHO, including on urgent issues like the influenza vaccine. But, let's hope that things, at least some of the dust in Washington settles, we get a better clarity. And in any way, this administration is not eternal. So we hope that the United States can become again a more committed member of the global health community. So that's a big variable, as you can imagine. But the world doesn't begin and end with the United States. And I'm sure other countries, other parts of the world are taking measures to fill the gap left by the US. So also on this point, I would be mildly optimistic.
Well, so to wrap up this fascinating conversation, many challenges, as you've outlined, some reasons for optimism. Huge thanks to you, Gian Luca, for taking the time to join us today, being so generous and sharing your insights on these important and also legally interesting issues. We've all really enjoyed the conversation, and if our listeners have too, you can join us on the first Monday of every month for more international law chats.
Excellent. Thank you so much for inviting me. It's always interesting.